Good evening and welcome. This is Face the Nation. We're coming to you live from our Stein studio complex here in Ratmalana. I'm Sonali Vanigabadage. Now, the war on drugs continues to wage in Sri Lanka. Politically, the country continues to fumble its way through the mess. However, tonight we thought of discussing about the after effects of this drug menace that continues to prevail in Sri Lanka. Last year too, we spoke about this very same issue with several professionals, some of whom are also here with us tonight to discuss the ill effects on people who are affected, the effect on the country as a whole, economically as well as otherwise. We'll also be talking about the rehabilitation efforts, whether it's enough, the psychosocial support for victims, for survivors of substance abuse, and the latest to hit the party scenes in Colombo and otherwise, the psychotropic substances, the party drugs, which have been making its way to Colombo's nightlife and nightlife elsewhere in Sri Lanka. Very quickly, let me introduce our guests to you. Joining us is DIG Ajith Rohana, Attorney at Law from the Sri Lanka Police. Good evening and welcome. We are also joined by Ms. Pabasara Veerasinghe. She is the Assistant Director of Scientific Research at the National Dangerous Drugs Control Board. Good evening and welcome to you.
Thanks.
Also joining us for the first time is Mr. Jumo Uduman. He's the Honorary Director at Mel Madura at the Sumitreo Drug Demand Reduction Program. Good evening and welcome to you. Joining us also for the first time is Ms. Nilushka Pereira. She's a Behavioral Health Research Consultant. Good evening to you. And last but not least, we have SSP Tilak Dhanapala, Director of the Police Narcotics Bureau. Good evening.
Good evening.
Joining us as journalists tonight are Shalan Benedict and Deshan Gonavala. Good evening, guys. Right, my first question is to DIG Ajith Rohana from the Sri Lanka Police. Mr. Rohana, there are several pieces of legislation enacted in Sri Lanka to deal with the varying aspects of the drug problem. For example, starting from the Poisons, Opium and Dangerous Drugs Ordinance to the Conventions Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances Act in 2008. We have a whole host of statutes and regulations which govern drug usage in Sri Lanka, drug smuggling, trafficking, the works. However, this problem continues to be one of the biggest social problems in Sri Lanka. Where are we going wrong in terms of the law?
Thank you, Sonali. First of all, I'd like to express my sincere appreciations to TV1. As you mentioned, last year also we discussed the same issues, same legislative enactments. But Sonali, as you mentioned, the drug problem has been increased, but apart from that, the quantities of detections also have been increased. So that is the difference between, in the past and, according to the today's at present context. The first law that was enacted by the British rulers in 1929, Dangerous Drugs Ordinance, and an amendment was brought to the principal enactment in 1984. Apart from the penal code offences, that enactment introduced capital punishment for drug dealers, especially the cocaine, heroin, all new drugs were introduced. And in addition to that, in 2008, this particular, as you mentioned, the Convention on Illicit Traffic and Narcotic Drugs and Psychotropic Substance, that particular act also was introduced by the legislature. In addition to that, there are some legal enactments that are not directly involved in the drug problem, but indirectly, impliedly, the provisions of those enactments also utilized in order to combat drugs. Especially in 2006, another two important enactments were introduced by our legislature. Number one, the Prevention of Money Laundering Act, and apart from that, Financial Transaction Reporting Act. In addition to that, in 2007, another enactment was introduced. It was Drug Defendants Treatment and Rehabilitation Act. So there are 12 odd legislations in respect of drug menace. I mean, according to my knowledge, being a law enforcement officer as well as an attorney at law, so we have sufficient enough legislative enactments in order to deal with drugs, because in 1984 amendment, it introduced capital punishment in respect of drugs.
An act is only as good as its implementation. So are these acts not being properly implemented, or where is the loophole?
No, actually, the provisions of the acts have been implemented, but as you all know, this is a common problem, not only to Sri Lanka, but also to the whole world. So therefore, there is a problem in the system, not only in our country, but also other countries. But sometimes, this particular problem involves multiple jurisdictions. So that is the main problem. And apart from that, the modern technology, also the internet, email, WhatsApp, Viber, all these modern communication methods used by the drug dealers. So then there is a problem. So therefore, still we are not able to completely terminate this problem.
Thank you very much, DIG Ajit Rohana, for your opening remarks. I move my attention now to Ms. Pabasara Veerasinghe, Assistant Director Scientific Research at the National Dangerous Drugs Control Board, which is the primary institution which has been vested with the authority to deal with issues pertaining to drugs. Ms. Pabasara, can you take us through the kind of work that your organization does?
Yeah, Ms. Sonali, NDDCB is established by an act called Act number 11 of 1984, and the responsibility given to the organization by this enactment is to implement drug prevention and control activities, and to formulate the national policy and the review of the national policy. And there are many other functions as well, and the powers have been vested to the authority by this act to coordinate all the agencies relating to drug prevention and control, and also to promote treatment and rehabilitation measures to all the drug dependent persons, and as well as to conduct and undertake research on drug related problems, and to conduct education programs for the adults and children. And on the other hand, Sonali, we are responsible for implementation of the provisions of the international conventions. There are 3 conventions: Single Convention on Narcotic Drugs, 1961, and the second convention is on psychotropic substances, United Nations Convention on Psychotropic Substances, 1971, and the third convention is on the Convention Against Illicit Trafficking in Narcotic Drugs and Psychotropic Substances, 1988. So according to the provisions of these conventions, we are the focal point in Sri Lanka for implementing all the provisions relating to drug prevention and control in Sri Lanka. So we do conduct many activities relating to prevention and control. Sonali, when we are going to take this issue and to effectively combat the drug problem in Sri Lanka, we had to approach in two different ways. Under two categories we had to focus on, that is supply control and demand reduction. So we have to, as the NDDCB, we are the focal point, and we give technical assistance to all the related agencies to promote scientific evidence-based supply control strategies. And on the other hand, for the demand reduction activities, we do prevention, treatment and rehabilitation, and we do conduct educational programs and research on supply control and on demand reduction. So with all these functions, we are trying our best to control this situation with the help of all related agencies.
All right, thank you very much, Ms. Papasara Veerasinghe, for your explanation and your opening remarks. I move my attention now to Mr. Jumo Uduman, Honorary Director at Melmadura of the Sumitreo Drug Demand Reduction Program. Mr. Uduman, as a precursor to the conversation, could you take us through the kind of work you do in your capacity as the Honorary Director at Melmadura? Speak to us about the services it offers.
Okay, a quick look at the history first. Melmadura is actually the Sumitreo Drug Reduction Program, and it's an ancillary of Sumitreo, which was set up in 1984, when it was realized that 30% of suicides in Sri Lanka were linked to addiction, alcohol and drug addiction. So initially it operated as a in-house and residential care program, but upon expert advice it was transformed into a drop-in and daycare center for support of users and importantly their families too, which is done today. The unit is run by around 15 dedicated and well-trained volunteers as well as 2 staff members. And Melmadura service delivers motivation and a very healthy lifestyle, which is more rewarding to the user during recovery than the use of alcohol and drugs. Now, also a few months ago, we opened our doors wider to look at people or welcome people who were suffering from behavioral addictions like pornography, gambling, smartphones, internet, social networking. And the response was simply overwhelming because there was nobody addressing that issue in Sri Lanka and they had nowhere to go to. So response was very good. Apart from that, we have also got an art therapy room where users who find it very difficult to talk about the innermost feelings in conversation are allowed to paint, write, draw, and express them and get them all out of their system. An important look at the statistics is very interesting, really, because it shows that from the visitors who come into Melmadura for help, the first and the second categories, at the highest and the second, are people who use the legal drugs of alcohol and tobacco. Heroin comes number 3 and cannabis number 4. So I feel that policymakers, stakeholders and gatekeepers should look at addiction in a broader spectrum and develop strategies to combat it effectively and appropriately.
All right, thank you very much, Mr. Uduman. I move my attention to Ms. Nilushka Pereira. She is a behavioral health research consultant. Nilushka, in Sri Lanka, something that we find is that there is very little attention paid to the psychological aspects of those going through addiction and substance abuse. In your opinion, what do you think needs to be done to ensure the prevention of substance abuse or the minimization of substance abuse?
Thank you, Sonali, for having me and for the question. I think there are different angles that we can look at this specific question, but one of the main things in prevention is to understand the risk factors, is to understand what is making the Sri Lankan population, as culturally diverse we are, have this reaction to addiction. Why are we, and what is making us as communities, as different people, be addicted to different substances? So I think the first one would be scientific research into the risk factors of people who are addicted and who could be addicted. So understanding in our communities, what is their likelihood of developing? Do they have a family history? Do they have any, how do they perceive stress? How do they cope with different challenges that are thrown to them? Is it the first thing they turn to, something addictive, or is there a different coping mechanism? So in terms of the psychosocial aspect, we usually focus on a curative method. We have the legislature that takes care of when people do get arrested, when people do have, when they're identified of the problem. But in terms of the psychoeducation part of why are we getting addicted, what makes you addicted more than me, or vice versa. So understanding the biological composition of addiction, like the dopamine pathway, which is the neurological reward system in our brains that make us addicted to not just harmful drugs, but smoking, alcohol, and also sugar. Simple things that are very much part of our day-to-day life. What makes us want this when we are stressed out? So what is the reward system behind it? So I think the main question relies on understanding how we operate in different situations. And that has to start from schooling years, giving people the education, children, the necessary skills to navigate the stresses that they face, to understand, okay, I'm going through this period in my life. What is the underlying cause of it? And knowing that this is when I should reach for support. And also educating parents on how to have this conversation with their own children. Why should you not drink? Why should you not smoke? Versus telling them, stop drinking, stop smoking. So when you give them statements like that without the underlying reason of why, you kind of have to make a connection for your own self, and sometimes that connection is not the most accurate and not the most healthiest. So I think in terms of prevention, what the underlying cause, the underlying most important thing for us is to research and understand how we behave and how we respond to situations.
All right, fantastic. Thank you very much, Nilushka, for your thoughts. Finally, I draw my attention to SSP Tilak Dhanapala, Director of the Police Narcotics Bureau, which plays a tremendous role in several aspects, including the prevention, detection, prosecution, investigation, and rehabilitation when it comes to drugs in Sri Lanka. Over the past few weeks and months, we've seen massive quantities of drugs being taken in by the authorities, lots of drug hauls, and a lot of talk about how successful the process now is becoming. I'd like to ask you to clarify for us the role specifically played by the Police Narcotics Bureau when it comes to drugs.
Okay, thank you, Sonali. Actually, that Police Narcotic Bureau was established in 1973, now completing 46 years of history. Actually, that as you said, actually our main role is mainly in 4 categories. There is PDPR concept, prevention, detection, prosecution, and rehabilitation. Investigation is also part of that. Actually, from that focusing of these 4 aspects, actually we are dealing with the reduction of supply side and the demand side as well. From prevention and the rehabilitation, first and last, that mainly focusing about demand reduction of drugs, and then from the other two, that detection and prosecution, mainly focusing about supply reduction. Without supply and demand reduction, we cannot go for the aim of a drug-free country. Therefore, actually, that as police and the Police Narcotic Bureau, that we mainly focus of these 4 areas. From that, actually, that as police, normally that a lot of people, they are expecting from us to deal with detections. The last few months, as you said, actually, that we were successfully detected lots of that narcotic drugs, especially heroin. Actually, that except cannabis, all these dangerous drugs coming out from the country into the country, the smugglers use mainly the sea routes, sometimes air routes as well. Then actually that our main responsibility to that reduce that supply routes into the country. But that is not enough actually, that our main focus should be the demand reduction measures as well. Without demand reduction, actually, supply reduction is not enough to go for
So the role of demand reduction is played by the National Dangerous Drugs Control Board,
yes, mainly.
Right? Okay. And since drug trafficking is not just a domestic issue, there's a lot of interconnectedness, a lot of other regional players. How does the Police Narcotics Bureau work in tandem with regional players like Interpol, the UNODC, etc.? Is there a culture of information sharing and intelligence coordination which takes place? How successful is it?
Exactly, actually, that both the local and foreign sources, actually, that we get lots of intelligence information that actually through lots of sources, especially that organizations such as that Interpol, then SDOMD, that is SARC Drug Offense Monitoring Desk, which is established here in Sri Lanka in Police Narcotic Bureau, connecting 7 countries in South Asia, and other regional organizations, and other world organizations, and also the domestic information and intelligence is also play a big role.
One more question. Now, the reasons for the most recent number of drug hauls, is it because the number of detections are high, or is it because media is reporting on it more, or is there an increase in the supply? Which one of the factors is it, or can't you say which one
actually that is mainly the increasing of detections,
right?
Not the supply actually.
Right.
Yes.
Okay. All right. Thank you very much. Before opening the floor for questions from Shalan and Deshan, one question that I'd like to pose the panel of guests. What happens when, say, a school-going child, for example, is discovered to be an addict? Say a 15-year-old child going to a leading national school in Sri Lanka, and the parents find out that the child is addicted to some substance. What happens from that point on? Ms. Pabasara, if you can clarify, what is the process that takes place thereafter in terms of the mental health aspect, in terms of rehabilitation, in terms of the legal process?
Yeah. Actually, in NDDCB, we conduct many awareness programs to all the school sector, and we do make aware all the principals and teachers, and especially we do have conducted lots of training to counsel a teacher in schools. So then we have made them aware how they should handle such incidences.
And how is that?
Yeah, that is then when the student is identified with the addiction or with dealing with drugs in school, then there are many aspects that the counselor teacher has to focus on. And then first we have to she has to identify the level of if she is or he is addicted to drug, then we have to identify the level of desire for the drugs.
Who is the relevant person who is vested with the responsibility of identifying, making that decision?
Yeah, we have made aware the teachers, or else we have given all the information. We have outreach officers in every district, so the teacher can connect to our outreach officer and get the information.
It's not a medical doctor?
No.
Right.
Actually, first we need to do the counseling and see how the problem exists in the child, and the level of desire and the interaction between the drug and the child, to what extent it has gone on. All these things we need to, and the myths they were in, all these components have to be analyzed. And with the help of our counselors, then we do counseling services for the child.
How many counselors are in service at present?
Yeah, there are about 30 outreach officers, and in our counseling, our treatment and rehabilitation centers, there are about, I think, 50 counselors there.
Isn't this grossly inadequate to deal with the national issue as big as this?
Yeah, that is true. That is why now we are training the counselor teachers in schools, and now the first training has been completed.
Training for how many teachers?
All the counselor teachers.
Right. And each school has a counselor teacher?
Yes, every school has a counselor teacher.
Right. Okay, thank you very much for that clarification, Ms. Pabasara Veerasinghe. Shalan, let's start off with you.
Thank you very much, Sonali. I will pick up from where you left off. I think you brought the conversation to a very interesting point. I would like to direct my first question to Ms. Nilushka Pereira. You said research is one of the key aspects that we should focus on when dealing with the drug menace here in Sri Lanka. As far as the research that you have conducted and you have been a part of as a behavioral health research consultant, what is the most vulnerable age group in Sri Lanka or in the world, whatever context, for children, or for a person to get addicted to drugs?
So thank you for the question, interesting one. I think first you need to understand that children grow at different stages, right? So you have different cognitive development, so their brain develops at different paces at different age groups. So when you say addiction, addiction is what we classify as substance use disorder. So that means that it has gone to a certain level that they cannot survive without.
There's no coming back.
Yeah, so there's no generally there's no coming back on your own. You are your body is extremely dependent on it.
Okay.
So what happens is when your child is growing, there's a front part of your brain which is called the prefrontal cortex that is responsible for your higher order thinking. So your judgment, your decision making, all of that kind of lies in that part. But there's also this part in your brain where it's the novelty seeking, risk taking, emotional part, which is called the amygdala. So when you are growing as a child, the amygdala grows faster than the prefrontal cortex. So there is a period, maybe usually in the experimentation phases, they say from about 13, 12, but now I think because
age of adolescence.
So age of adolescence, but now because of technology, things are changing. Children are exposed to far more than we actually have studied to see them being exposed to, because social media, everything's extremely accessible. So when you look at that development, their risk-taking behavior develops faster than the decision-making. So in terms of controlling that behavior, it's their brain's not ready yet. So which is why we need to have strict boundaries as parents to be able to identify, right, my child is a little bit more risk-taking, or they need that novelty in their life. Because personalities are different. We have to treat everybody as unique individuals, not as one pool and and understanding that specific people have personality traits that might lead them to experiment with drugs or experiment with different things that might not be as healthy for them is also being brought back into understanding how their body works. So just for an example, having a conversation with your child about addiction is important while making them understand this is what your body is undergoing.
So would I be correct to assume that children are among some of the most vulnerable groups
Definitely.
to get addicted to drugs?
Because it depends on what they're exposed to as well. If their family is...
The age limit or the definition of a child could vary.
Yeah, completely.
Okay.
And what they're exposed to as from their family environment, from their immediate community, it depends on so many different factors.
I'd like to ask Mr. Uduman, you too have experience of dealing with people who've been addicted to drugs and people who've hopefully or possibly moved back from it and started off a better life, a brand new start. What's your take on this?
Yeah, okay, so I can kind of take you through the process which we use. For instance, if somebody comes in with an addiction, whatever the drug is, we kind of go back to their feelings. We help them to explore all their difficult feelings, for instance, pre-using, before they started using.
Okay.
Then at the experimental stage, then at the stage when they were occasionally using it, regularly using it, when they started abusing it, and when finally dependent on it. So we explore all their feelings, find out exactly what drove them to the dependency stage. And the interesting part is here is, say for instance, if you look at something like heroin, and if somebody is taking, say, 3 packets of heroin a day, we don't ask them to stop immediately. What we do is we give them a plan. We discuss a plan with them. So, okay, at what times of the day do you take these 3 packets? Why don't we make it 2 packets for the next week? So they agree to that plan. And they come back after 2 weeks, very happy that they have stuck to the two packets. Then we go to the next stage of the plan, which is 1 packet a day for a week. And that's how we wean them away, finally, and give them healthier options than the drugs that they're using. Would that explain what
Yes,
you need?
thank you very much.
Right. I want to direct this question to Mr. Rohana.
Yes.
Mr. Rohana, the Sri Lanka police plays by far the biggest role in ensuring that this drug menace is curtailed to a great degree. But yes, there has been an increase in the number of raids, but also there has been this discussion or this unnecessary tagline that Sri Lanka is becoming an international drug center, given its strategic location and whatnot. How is it that prevention is always better than cure? How is it that we can actually minimize the problems that do arise because of these drugs coming in? Are there loopholes that have been identified in the process of actually stopping these entering the system?
Yeah, thank you. It's a good question. Before that, I need to mention, the first drug addict in respect of heroin or these modern drugs was detected found in 1979. 1979. The first person was arrested in Hikkaduwa in 1983. And since 1983, we have been conducting several raids in respect of especially heroin. But in year 2018 is the year Sri Lanka police detected the largest quantity of heroin. Now, if you see this, look at this chart, you can understand. This is only for a period of 4 years. 4 years. In 2015, we have detected 46 kilos. 2016, 206. 2017, 314. 2018, as at 31st of December, 739. That is the biggest amount during this 40-year period. That is the biggest amount. And in addition to that, we have arrested last year 40,900 odd suspect in respect of heroin. So this is, I mean, we have conducted raids, we have arrested suspects, we have seized or the freezed all these drugs, but still the problem is there, as you mentioned.
Mr. Rohana, what I want to link this to a topic that's very pertinent in especially across society today, which is the arrest of a very significant member of the drug dealing fraternity, if I may call it, over in Dubai. Now the thing is, in the days that have succeeded that arrest in Dubai, we have come to identify of a lot of other people linked in this system. And like you mentioned, yes, there has been massive improvement in the number of arrests made and the confiscated drug quantities, etc. But the thing is, for them to build such a complex network means that has there been a lapse on the part of the authorities?
Yes. You know, now as I mentioned earlier, there are a number of enactments in respect of drug issues. But there are two institutions, Sri Lanka Police and Sri Lanka Excise Department. So we have been given powers. We have been empowered by the law in order to detect drugs and apart from that to arrest drug dealers or whatever the persons, whoever the person dealing with drug issues. So these two institutions, Sri Lanka Police and the Excise Department. But in addition to that, there are stakeholders in the system. As we mentioned earlier, the Dangerous Drug Control Board and the Sri Lanka Custom, they have a massive role. Sri Lanka Immigration, they have a massive role. And apart from that, Sri Lanka Navy, Coast Guard. So we all are in the system, but we have been given powers. Now, the problem is, you know, I mean, in the past also, we conducted several raids, detections, but since 2014, 15, 16, 17, so we have a very good link between the stakeholders. Now, generally, all these drugs, heroin, cocaine, especially heroin, coming from Afghanistan, Pakistan. And especially they bring these drugs to Sri Lanka by sea or by air. So we are an island. So therefore, according to the experts' opinion, we can eliminate this drug problem in the country because we are an island. But other countries, Afghanistan, Pakistan, India, they have borders, they are connected. The problem is, you know, every time we didn't have a proper coordination between, among the stakeholders. That was the problem. Now that network has been established, a special presidential task force has been established. So therefore, we were able to detect all these big quantities of drugs. And apart from that, we were able to arrest the biggest number of suspects. And I believe that. So if we are able to implement or enforce the law for another 5 years of period, so definitely we can minimize.
Yeah, Ajit Rohana, I had mixed feelings when you said that 2018 was the year that we seized the highest haul of drugs here in this country.
Yeah.
On one hand, it's good on law enforcement authorities. I mean, we're capturing more drugs. But does this also indicate an increase in the drugs that come into the country? I would actually like to direct this question first to SSP Tilak, because, of course, as the director of the Police Narcotics Bureau, you're a man on the ground. You know how these arrests are made. Is it that the police have become more efficient and vigilant in seizing these drugs, or has there been a drastic increase in the amount of drugs that are actually making their way into the country?
Actually, that giving a straight answer for your question, my belief is this is the result of increasing the rates, not the supply actually. That now that according to the statistics and these sources we have, there is a reduction in supply in Sri Lanka. That is very good news for all country. Yes.
So thank you very much. So you mean to say that this supply of drugs in the country was there even before the year 2017, 2016? So
Yes.
it's just that these weren't detected back then.
Yes. Actually, this is because of the intelligence, especially that our intelligence network, both local and foreign, strengthened over the last few years. That's why we will succeed. Actually, that therefore, actually, that's why I said earlier as well that that supply reduction is not enough. Demand reduction
Has to be there.
has to be that is the main source actually, that main factor.
Getting back to the first question that I directed to Nilushka, you said that children are the most vulnerable group to get addicted to drugs. I'd like to ask DIG Ajit Rohana as to what the police department is doing on their part to cut the supply or the demand as far as the children, the demand that children have for drugs or the children who are addicted to drugs.
Yes, generally, as you all know, according to the concept of our penal code, the culpability of crime age is 12. So if a person, if a child has committed a criminal offense, if that particular person's age is below 12, it is not an offense under our law. Because earlier it was 8 years, now it has been increased up to 12. So therefore, but in addition to that, there is an exception. If there is a person, between 12 and 14, a medical doctor or there is a panel there. So if they have an opinion that we are not able to give that culpability of that particular crime to that particular person because of mental condition and all these things. So then if that particular person is above the age of 12 and below 14, so we are not going to file cases. Your question is, let's say as Sonali mentioned, it's a 15-year-old boy. Yes. Then according to our law, he should be dealt with the law. But before that, we are conducting several preventive actions, preventive measures in order to curtail this. We have, we call Praja Police Committee, community policing committees. So each and every Grama Seva division has that committee under that particular respective OIC. So they are conducting awareness programs, and apart from that, the Dangerous Drug Control Board or the volunteers, they support us, and sometimes the police officers, our community policing officers, they go to schools, they conduct lectures, and apart from that, we have identified some areas, especially in the recent past, some urban schools also had been targeted. So we send our officers from, local police officers, and we conduct lectures. On one hand, we do that type of preventive works, but on the other hand, we try to arrest the supplies, not the students, but there are people in the vicinity, so they are the facilitators, they are the drug dealers, so they are dealt with the law.
Ms. Veerasinghe, I want to pop this question to you. Now, as the Dangerous Drugs Control Board, I'm sure you are aware more than I am that there is a significantly higher usage, or at least it's easier for particularly urban youth to access drugs, especially recreational drugs.
Yeah.
Now, the thing is, it's becoming increasingly easier.
Yeah.
How is it that the Dangerous Drugs Control Board, as an organization, is taking steps to actually curb this?
Yeah.
Because at the moment, I don't have to explain, but I'm sure you know, of the ways that especially middle class, upper middle class families and children from the middle class and the upper middle class tend to consume, especially recreational drugs, with absolute ease?
Yeah, that is actually we have taken initiative actions in this regard because of the communication tools and the development of such tools like internet and social media and such things. Now the young people tend to use these drugs, and the traffickers also promote these drugs through this media. So we have taken initiative actions on this. We have formed a working group on this regard, and that is called Working Group on Intelligence relating to internet and postal drug trafficking. So there are institutions that who coordinate with us to take initiative steps and to advise the board for the steps to be taken. And firstly, actually, we are now in the stage of collecting all the intelligence through all this media. And the institutions related to the working group is the PNB and CID and the CERT and all other related agencies. Sri Lanka Customs also working under this working group. So we have now been analyzing all these sources that the traffickers are being used to promote young children on these drugs.
Very quickly, Mr. Uduman, why do you think that there is an increase in the use of, particularly of recreational drugs among urban middle class, where things tend to be a little bit easier normally than they do for the lower ends of the social strata, but the urban middle class, especially the people, young people, tend to be increasing their consumption of drugs? Is this peer pressure? Is this just trying things out? What do you reckon?
What kind of drugs are you referring to?
I don't think I'm allowed to say.
Is it the party drugs or?
Recreational drugs.
What cannabis then?
Recreational drugs.
Okay.
Let's just leave it at that.
That's actually it's quite common now in Colombo, in the Colombo schools. In fact, we did a program recently in one of the international schools, and we realized that many children there use cannabis and together with alcohol. But the reasons are probably because of what she said about social networking, how the messages fly around. Try this, I was high, you can get high, and a whole lot of peer pressure. It is really peer pressure that pushes people, children really, to take drugs because they want to belong to that group. That's very important to them because the fear of being isolated makes them want to experiment. And you get another kind of type of people who want to act dangerously or rebelliously. So there are so many different reasons why they want to use the drugs. Does that answer your question? Or
Yes, it does. Sonali?
Right. Thank you very much, Mr. Uduman, for your response. With that, we go in for a short commercial break. We'll be right back. Welcome back. You're with Face the Nation. We're discussing the issues surrounding the drug menace in Sri Lanka. My first question in this round is to DIG Ajit Rohana, Attorney at Law. Ms. Rohana, on a daily basis, we see the thousands and thousands of cases in the magistrates' courts of individuals being remanded for the possession of small quantities of marijuana, for example. So we see the manner in which this takes place every single time, where there is no preventative element because these guys go back to being users of marijuana most of the time. So don't you think that whilst this also delays the legal process and is a waste of court time, it also doesn't really prove to be useful in any manner Don't you think it needs to be better handled? For example, there should be other preventative mechanisms which need to be implemented, etc.
Yes, it's a very good question, Sonali. I believe that, marijuana is not the biggest problem in the country, but generally the drug problem. The main reason is, this particular problem is not only connected to that particular individual. It is connected to all other crimes. Now in our country, regularly 30 to 40 housebreaking cases are reported. I mean, the big cases, the value above 50,000. So if he takes those cases, 90% out of the total cases are connected to drug users. So they are the perpetrators of these housebreakings.
Okay.
Because, as he mentioned, if an individual takes 3 or 2 packets of heroin regularly, so he needs to spend at least 4,000 or 4,500 rupees.
Right.
4,500 into 30 days, it's very big money. So you cannot spend that money, I cannot bear. Then, so they are compelled to commit crimes, snatching chains, or removing side mirrors and selling it, or sometimes conducting or committing housebreaking. So the main reason, I believe, that as everyone has mentioned, that there are 2 things. Number 1, reduction of the demand, reduction of the supply. Apart from that, as a police officer and experienced police officer, I believe that the social media, so it creates many problems. The Sri Lanka is the only country in our region, we don't have any restriction on social media, Viber, WhatsApp, Imo. In the recent past, everywhere else, Nigambu, Ungal, many areas, people, they send WhatsApp messages and 600, 700 youths they gather there, then they distribute drugs, as you said, marijuana, opium, heroin, cannabis. So therefore, we all have a responsibility. The religious leaders, the school teachers, the principals, the parents, so they have a responsibility from their, the childhood, to teach, to instruct our children to not to adhere with drugs. And apart from that, especially now time has come to implement some sort of restrictions in respect of social media. Otherwise, this will be spread, and if we are conducting, as she said, there are instructors, what you said, at the school level, you have
Outreach officer.
Outreach. But it is not sufficient. The social media is stronger than all these mechanisms, so they are spreading everything. So if we are going to, have a drug-free country, so we need to have restrictions on social media.
Thank you very much. I move my attention to Ms. Pabasara Veer Singh, Assistant Director Scientific Research at the National Dangerous Drugs Control Board. Ms. Pabasara, are you in a position to tell us the kind of budgetary allocation that is given to the Dangerous Drugs Control Board annually? Do you have the figures with you right now?
No, right now I don't have. Actually, for the from January to March, actually, the budget has not been allocated, and we are in a big struggle to do our programs and all.
Right.
Yeah, but now we have started for getting grants from outside organizations like UNODC and International Government Science Advice. And
so are you saying that the main body vested with the responsibility of combating drug crime in Sri Lanka has not been made budgetary allocations?
Yes, we are getting budgetary allocations, but concerning the increase of the problem and concerning the training programs we have to conduct, and concerning we do also laboratory services. For that we have to spend a lot of money on chemicals and for drug testing. Actually the budgetary allocation we are getting is not sufficient enough to do more programs and to effectively conduct our services.
Right,
Yeah.
okay.
And also in addition to what Mr. Ajit Rohana said, actually I also would like to add to the comments he mentioned, and because of the concerning the drug addiction problem, I think now we will have to revisit our strategies. So we need to conduct more researches with scientific evidence-based evidence. We need to conduct more researches on that side. And on drug addiction, actually we need to look into deep whether we address the root cause of the problem. Actually,
what does the existing research say as to the root causes of this issue, or has there any research been done so far?
Yes, we have done lots of research.
Right.
And the problem is the myths. There are a number of myths around the drug addiction.
Such as?
Such as like when we take the issue like the drug addiction, we have to go in depth, and if we analyze the drug addiction process, the people are not addicted to drug itself.
Okay.
So they are addicted to the sensation they got from the drug.
Right.
With that sensation, they make images in their mind.
Okay.
And they mentally do constructions, and then the attitudes they create mentally as images, and they react on these images. So the root cause of the problem is not the drug itself, but it is the sensation they get and the mental constructions they do in their own mind, images. So our treatment methodologies should address that issue properly, then only we can come out of the problem.
What are these treatment methodologies that are being adopted at present?
Yeah. At present, we are adopting a psychological treatment method, and we also do research on mindfulness. And with that psychological treatment methodology, we try to address the behavior and as well as the attitudes. That means that we have to make them understand the reality, because they are all in different myths, which are not the reality.
How many patients or how many persons suffering from substance abuse do you get on a monthly basis, on average?
Yeah, on a monthly basis, I think we are addressing about 1,000 drug addicted people, and our treatment centers can address only about, I think, nearly 400 drug addicted.
What about the rest of the 600?
The rest of the persons, we do counseling services, and we have counseling centers.
How many counseling centers are there?
There are 2 counseling centers.
For the entire country?
Yes, but our outreach officers in all the areas will do counseling services, and our counselors in the treatment centers also do the counseling services. So with that, actually, we can't manage manage all the drug dependent persons, but we do have now implement new strategies on this issue, because we are going to increase our cadre counselors and train other counselors as well to address this issue.
Are these patients those who are sent through courts mandatorily, or those who come in voluntarily, or is it a combination of both?
Yeah, the drug dependent persons are coming voluntarily, and as well as they referred by courts, and also referred with the intervention of parents, friends and relatives. They come to our treatment centers, And also those who recovered from the addiction, they also refer many drug dependent persons to our treatment centers.
All right, thank you very much. Ms. Pabasara, but you did mention that there is a shortage of funding.
Yes.
And budgetary allocation.
Yes.
What's the ministry that you all report to?
We are under Ministry of Defense.
Ministry of Defense.
Yes.
Fantastic. Okay, thank you very much. Mr. Jumo Uduman, Honorary Director, Melmadura Sumitreo Drug Demand Reduction Program. Mr. Uduman, your area of expertise is rehabilitation.
Yes.
This is an area that Sri Lanka, in many respects, continues to not pay too much attention to. So we have these amazing human beings who, just because of a drug addiction, are shunned by society, are cornered and disregarded. And little or no attention is drawn towards ensuring that they are reintegrated into society and they live a productive life thereafter. In your experience, what are we doing wrong in this respect, and what do we need to do to correct ourselves?
I think it should all start with our curriculum in schools,
right?
As I was discussing with her today, that the lack of emotional intelligence in our young people today, which is the ability to understand one's feelings, cope with one's feelings, improve your decision-making skills, problem-solving skills, and also empathize with other people, understand their feelings too. So that's what's lacking today, I think, and people get cornered, isolated, labeled, and there's always a stigma attached to somebody who's taking drugs. They say, "Ya kudukarek." So that stays.
Kudukarek putek.
Yeah, exactly. So I mean, and for them to forget about that label, they need to take it more and more. It's like an alcoholic, because he has been labeled, he has been shunned, or something has happened down the line where he has not been able to deal with it. He needs that drink to forget about it or to suppress it until the next day in the morning. So what we feel is, from what we understand, we have a huge amount of data actually from 1984, which we can share with anybody who's interested, about the trends in drug use and why they use it, the environmental issues, their family issues. So we should all put our heads together, use this data constructively, and then develop a strategy to handle addiction in a very kind of a proactive manner. And also, one more thing is I'd like to add is the complete lack of rehab centers. Not only for heroin, I'm talking about alcoholism, which is rampant today.
Right.
And you only get a few government hospitals that run wards which detox people.
Right.
There's no counseling at all for alcoholics or for tobacco addicts. So and if you look at the amount of revenue that the government earns from the industry,
right,
they could easily allocate a small amount towards rehab. They earn billions every month from them.
Sure.
So we need to address this issue to the government themselves and tell them, come on, you're earning so much of money, there's so many people affected by this, let's do something for them.
Right. Mr. Uduman, in your experience now, suppose I am a user of a psychotropic drug, and I choose to seek help. Where do I go to initially?
Exactly, Sonali. There is really, now if you look at Melmadura, which is situated in Colombo 7 in Colombo, it seems the only place in Colombo. And we run ads every week in the English papers now and the Sinhalese paper too. And on the day of the ad, the response, the people who call in are from all over the country. And they are so upset that they can't come to Colombo. They can't bring their loved one to Colombo. It's so upsetting to listen to their stories. කොහොමද මම එන්නේ? පොළොන්නරුවේ ඉන්නේ. So that means that there is no support system in Polonnaruwa.
Right. Very quickly,
Yes.
Ms. Pabasara, could you respond to that? If I am a drug addict and I want help, who do I call?
Yeah, actually we have established an information center. They are at the NDDCB premises, and also His Excellency the President declared about the toll-free hotline, that is 1984. So you can call to this number, and we do give free counseling service, and we direct you to treatment centers or our outreach officers or a counselor, and or a private treatment center, or there are designated treatment centers as well. So we refer to those centers or counseling services, or a person who do counseling. And I think now the people are getting more aware on this hotline, and we are getting more information, and we do actually do in collaboration with the Police Narcotic Bureau, supply control related information are referred to Police Narcotic Bureau, and all other addiction related issues are done by the NDDCB.
Right. Mr. Uduman, you said that you have data collected from year 1984, which you are willing to share with anyone who wants it.
Yes.
Have you had any experience working with the National Dangerous Drugs Control Board?
Well, we do. They always call us for meetings, and we attend those meetings, and then we are briefed about things.
Okay.
But I feel about this hotline which she mentioned, sometimes, because the name Dangerous Control Board can put people off in calling. You know what I mean? Sometimes they are scared. They think that, they will be taken to the police or something will happen to them. So we need to have a more user-friendly kind of name to attract them, and also to disseminate that information. That information is not being disseminated. Otherwise, why are we getting so many calls from helpless people who don't know what to do?
So, Ms. Pabasara, I think that's some constructive criticism.
Yeah.
But since you spoke about the importance of scientific research and research in general, perhaps there could be some information sharing between the two organizations as well.
Yes, actually there is, we are lack of coordination and collaborative mechanisms. Now the NDDCB is focusing more on such platforms, and one of such platform is the Science, Technology and Innovation platform.
Right.
So there we are going to get all the scientific professionals and all the law enforcement and other professionals in the criminal justice system to one platform.
Right.
And there we are going to make collaborative mechanisms to take the issues of the people online and then give them solutions, and to involve the civil societies, all the NGOs and all the general public and volunteers also. We are connected, we are going to establish this mechanism, and we are going to inaugurate the platform in March first week with the expert meeting we are going to have. So with that, I think we can work more collaboratively in this field, and we can give our services more to the general public and those who are affected by the
All right. Thank you very much, Ms. Pabasara and Mr. Uduman. Nilushka, I draw my attention to you now. Since you work in the area of mental health, take us through the difference between the definition of a counselor and other mental health workers.
Thank you, Sonali, for that question. I think we've had the word counselor being thrown around quite a bit today. And I think it's important to understand the distinction between a counselor, a psychologist, and a psychiatrist. And these are the three main people who generally work. We do have psychiatric nurses and other mental health workers, but in our system right now, we do have counselors working, and generally counselors are trained to handle simpler issues like death, grieving, or it could be breakups. So very simple issues that don't have a lot of different, like a complex health behavior. Whereas when you take something like alcoholism or addiction, it's an extremely complex health behavior because we are assuming human beings are rational, but they're not really when it comes to this specific behavior.
Sure.
So in terms of dealing with addiction or dealing with narcotics or anything that is very difficult to understand, it's very individualistic, we do need a higher level of care. And I say this with, we do need a lot of training in the sense that there are specific ways and methodologies that you deal with addiction. And you get trained in substance abuse specifically as a psychologist. If you look at the global picture, there are ways and means that you work in a multidisciplinary team. You work with the medical doctors, you work with the therapists, you work with counselors who give them ongoing support. And there's also medication that helps them wean off certain addictive substances. So the differences, understanding the differences, and so for an example, a psychologist is somebody who gives therapy but no medication. And they would work collaboratively with a psychiatrist to give, if the person needs medication, to make sure that they get that holistic approach of care. So it's just important to understand that distinction and the gravity of this specific behavior that we're trying to address when dealing with it.
In the government sector, what is this recognition like in terms of designations? You get medical doctors, for example, you get the nurses. What about the psychiatrists, the psychologists and the counselors? What kind of status do they get?
So in terms of psychologists, they are not necessarily part of the government as of yet. There is a specific process of licensing, but only for clinical psychologists.
So psychologists are not recognized?
They're not part of the government health sector as of yet. They're not part of the health teams. So there are.
And is that not a massive lacuna in the Sri Lankan medical system?
Yes. Obviously, we are working towards building a more holistic model, but there is a lack of allocation for mental health workers as a whole due to budget, due to resource and other struggles that we face as health professionals. But we do have psychiatrists coming in, but that sometimes you don't need medication all the time. You need that ongoing therapeutic support to get over certain behaviors. So right now we are at a huge lack of mental health resource as a whole in Sri Lanka.
All right, thank you very much, Nilushka. Finally, I move my attention to SSP Tilak Dhanapala, Director, Police Narcotics Bureau. Mr. Dhanapala, can you take us through the major issues you come across when dealing with this aspect of the subject of drug trafficking, because you need to work in collaboration with other multiple stakeholders such as the customs, then other regional players, as I mentioned before. What are some of the practical difficulties that you face which you think could be avoided if policymakers worked properly, for example?
Yes, actually that when we are discussing about that drug trafficking into the country, mainly the traffickers, they use the sea routes rather than air routes. Around 95% of that supply coming using these sea routes. Sometimes they use local fishermen as well to trafficking those the drugs into the country.
Right.
Then actually that there are a lot of agencies to responsible, and we have that all of those agencies responsible to curtail this drug smuggle into the country. For example, that coastal guard, that Navy, and the customs, all of these agencies, with the collaboration of other agencies such as police, excise department, like that, when especially that talking about the supply. But we have a system actually that we have.
Is it an effective system, or do you think there needs to be certain amendments made? Now, for example, Nilushka just pointed out the fact that psychologists aren't given proper recognition within the medical system in Sri Lanka, which is a huge lacuna. Similarly, when it comes to your area of expertise, are there such lacunas which can be rectified if we draw the attention of the authorities to it?
Well, actually, that we have a good collaboration, that we have a good that sharing of information and that working together in the system actually, that but it has to be improved. I'm not telling it is perfect, but we have a system actually. But I think with the geographical location, Sri Lanka, we are in the middle of a golden triangle and the golden crescent. And you know, the Afghanistan, Iran, Pakistan, those countries, they produce 90% of opium of that global demand.
Right.
Yes, and they use these sea routes, especially, and also sometimes, as you said, as a transit point, Sri Lanka. Actually, that we need to pay attention more about the curtail those routes, especially sea routes of smuggling. We do have lots of resources and agencies playing their role, but right. I would say it should be increased, the capacities.
Okay, so you're satisfied with the collaboration
yes.
Between the agencies, multiple agencies?
Yeah, I'm satisfied, but at the same time, I think it should be increased day by day. Otherwise, we cannot face the.
Okay, thank you very much. Very quickly, a question to the panel. This comes in from one of our viewers. Does the panel consider cannabis to be a dangerous drug?
Yes.
Yes, certainly.
We have like a unanimous yes?
Yes, it is.
Because
yes, of course.
Okay.
I mean, within this 4 years' time, we have detected over 500,000 kilos of cannabis. So it is, just like heroin, because it creates many social problems, and apart from that, it creates health problems to individuals.
Okay, the question by one of our viewers goes on to say, the panel is saying this in the context where globally cannabis is becoming legalized. Ms. Fabasara, what's your take on that?
Yeah. Actually, when we take USA, they are now legalizing cannabis. And we have to concern their problem in depth. When we analyze their situation, they are in a very critical situation. There are 85,000 deaths per year in USA.
Due to?
Due to drug abuse problem, especially the opioids.
Right.
So to control that situation, now they are going to give them another control drug. They say that it is less toxic. But when we analyze our situation in our country and our treatment centers, there are more drug-dependent persons on cannabis. But now they are developing their psychiatric disorders, like when they get addicted, we say that they are dependent on drugs and they have some psychological issues, and then the nervous system is get damaged. So with our treatment and rehabilitation measures, we can recover them. But now when they are taking more on cannabis. Now they are becoming like, they are having like mental disorders. That means the drug has made them, their nervous system damaged totally, so that our rehabilitation and the treatment methods are not effective much to recover.
The statements you make are backed by medical
according to the
research?
data, yes, according to the data we get from our treatment centers, they are got addicted to cannabis, and about 80% of the drug dependent persons, they are having like psychiatric disorders there.
I'm happy to comment on it as well. I
Yes,
think the
Nilush.
confusion comes from the medical legalization that comes, and now there are certain countries like Canada, the Netherlands, who have legalized it. But I think what we're trying to stem from it is that when it comes to cannabis, the research is varied. It's extremely varied, and it has a higher, so with long-term use and heavy use, it can trigger psychiatric illness like schizophrenia. So you start hallucinating, you start having delusions, and it can, so I think we have a unanimous agreement when it comes saying that it is dangerous, mainly because the long-term use of it, no one has, it's difficult to say that it's a safe thing to consume, because there's a wide variety of side effects that can come across, like paranoia and also triggering of other very serious psychiatric issues.
So you're talking about heavy usage of cannabis.
Yeah, but still that we have to identify, Sonali, the root cause of the problem.
Right.
We need to implement our strategies on the root cause. Otherwise, we won't come out of the problem.
Sure.
So we have now identified the root cause of the problem as it's not the drug, but their addiction. That means they are addicted to the sensation of the drug, and the mental images they construct in their mind is the problem.
Okay.
So we need our strategies to address the root cause of the problem. But this is introducing cannabis to drug dependent person is not, we are not addressing the problem properly. We are just trying to minimize their effect, minimize the effect of the drug.
But now, if we contrast this with the synthetic drugs or the party drugs, the names of which I shall not mention on this program, as I want to maintain the guidelines, they're quite dangerous. They result in neurological damage.
Yes.
So, I mean, it's a bit of a contrast, isn't it?
Yes.
Because I'm also a layman to this, so I need your expert opinion on this. Because we have parents watching us, we have other professionals watching us, sending us questions as well.
Yeah. So we need to focus more on the problem in the sense of that psychological problem, because we need to, now as I said, we need to focus more on the psychological aspects of the persons. We need to identify what are the causes for drug addictions, why they tend to drug use, and the images they react not only with the drug, they react on the sensations they are getting. So that psychologically we need to strengthen their mentality to avoid the drugs.
All right, thank you very much. Deshan.
Thank you, Sonali. I want to move my attention to Mr. Rohana. You made a statement particularly about this one, about cannabis that we are talking about now. As the state, as the police, on a government level, are we opposed, we oppose cannabis, correct?
Yes.
And we look to try to reduce its consumption. But then I want to quote some newspaper articles. It's been quoted on The Standard in the UK and certain Sri Lankan newspapers as well, about how the government of Sri Lanka plans to allow cannabis to be grown for the purpose of exports. Doesn't this make your job a little difficult when you don't know where the policy stands?
No, I don't know whose policy is that. But actually, as she correctly mentioned, my answer is the same. Because you know the cannabis is the conventional drug that creates many problems. But you know, there are provisions in the existing legal enactment also. I mean, these Ayurvedic doctors or the medical practitioners, they can use cannabis for, I mean, their, productions, manufacturing some drugs and all these things. So we are not opposing that. But I mean, if it is used by the adolescent society, so it will be a very big problem.
I also want to ask you something that consistently comes up in the social sphere. You see a lot of debates taking place, especially in social media. And I want to ask you this because there is a common feeling among the public, if I may say so, that politicians tend to play a role in what has become the drug trade in the country. And today, we had MP Udayagam Manpila state that behind every drug dealer is a politician. Do you think that there is the possibility that there is some sort of protection, and that is what allows the growth of this, the growth of this problem?
I mean, now I have been a police officer for a period of 30 years now, 3 decades. And I have been conducting several investigations into criminal investigation, and apart from that, drugs also. And I had been the media spokesman for 4 years. But time to time, these type of statements are made by various type of people. But I mean, according to my experience, we had only 2 or 3 cases that local politicians, not the national level politicians, involved in drug problems, and they had been arrested by police, and thereafter we were able to file cases against them. One of them had been convicted. So I mean, the individual can make that type of opinions or the comments, but according to, I mean, my experience, it has not been proved that I mean, a politician is behind every drug deal.
Mr. Dhanapala, I want to ask you something along the very same lines. Do you think that the problem is so bad because it is ingrained to a certain degree, at least in the system of what has become Sri Lanka?
Now, actually, the answering to your that earlier question as well, actually, according to our investigation from the Police Narcotic Bureau side, that is also actually not proved that all of these drug traffickers that behind some politicians, that actually that is not true. Actually, that as politicians. Normally that in Sri Lanka that the general public, so they are also thinking about very bad ways about politicians. That is in general. But according to our experience, actually they actually they normally don't that interfere and asking to give relief for the drug traffickers or the drug dealers. As well, and normally actually the problem is not that we have to address this issue in scientific ways. Then we can curtail, we can go for a drug-free country.
I believe we've spoken quite a lot about the problem here, the drug menace, and what are the problems that we face. But I believe it's important that we focus on the solutions to these issues as well, at least opinions on what could be done to resolve this issue. I'd like to direct my first question to Mr. Uduman. You've been spending time with a lot of people who've suffered with drug addictions, alcohol addictions. In your perspective, and you spoke on this before as well, you said there aren't places where these people can call or go towards to seek help. What do you propose the government of Sri Lanka or any stakeholder do to address these kinds of issues?
I strongly feel that every town at the moment, if you look at the gravity of the situation, I'm not only looking at hard drugs like heroin, I'm talking about alcoholism, which is rampant, and there's no way that anybody can go for any help anywhere except go to a OPD and then get admitted to a psychiatric ward and get detox. There's no counseling service.
But I don't believe that the general public is aware of that procedure as well.
Yeah, they are not, and an OPD doctor will never counsel an alcoholic, right? So even when an alcoholic comes to Malmadura and has withdrawal symptoms, we don't talk to them. We send them for a detox first to Ward 59 with a letter, and then get them back and then start counseling them. But one thing, if you look at, I'm talking about alcoholism, right? If you don't mind me steering away from heroin. If you look at wine stores and what times they open, 9:30, 10 o'clock, whom are they catering to? They're catering to the addicts. Who goes and buys a bottle at 10 o'clock in the morning? So we need to reduce access also. Having access at 5 o'clock might be better than starting off at 10 o'clock. But at the same time, when we talk about rehab centers and the amount of money that the government earns from the revenue of these industries, they can easily afford to have little counseling centers somewhere. And people like Malmadura, we can train those trainers, Even if there's nobody else to train them, we can train them. And there are lots of psychologists around Colombo who train them.
Also, DIG Ajit Rohana, as the police department is a measure in the preventive sphere of the drug menace in the country, are there counsellors at police departments? Is that an option that you're looking into? What kind of measures are you taking? In terms of prevention or providing a person who is already addicted to this to avail himself of, to relieve himself of it?
No, in terms of the provisions of this 2007 Act, the officer in charge of police stations have been given powers by the legislature. So if a drug addict person is found, so the OIC should produce him before the magistrate and to a judicial medical officer. Then thereafter they are sent to rehabilitation centers. But apart from that, as I mentioned earlier, our children and women bureaus, the officers in charge of those units, they are conducting lectures. And some police officers, they have undergone several training programs in various institutions on counsel.
Okay, thank you very much.
Sonali?
Well, before we go in for our final round, another open question to our panel. When you say dangerous drugs, what exactly is the definition that you give?
Yeah, actually there are many definitions, and when we concern the international drug conventions, then there are the dangerous drugs are defined in under two different categories: narcotics and psychotropic substances.
Right.
So the narcotics are defined by the drugs which are controlled under Single Convention on 1961.
Right.
And the psychotropic substances are defined such as the drugs controlled under Convention on Psychotropic Substances 1971. That means the drugs which were abused by until 1961 are defined as narcotic drugs, and then the drugs which are being abused after 1961 and then up to 1971 are called psychotropic substances. But there are other definitions as well. So the drugs are, all the dangerous drugs are defined that the drugs which cause psychoactive effects in the people who take the drugs. And another definition, comprehensive definition is given that the interaction between a person and a drug which cause compulsory for the person to take the drugs in due to its psychoactive effects. So such drugs are called dangerous drugs. That means all the dangerous drugs, they affect the central nervous system of the person who takes the drug. This means, as we all know, the central nervous system means mainly the brain. And it affects our brain and the neurosystems and affect all the functions of our body and other coordination between the organisms and the other activities of the person.
Thank you very much.
I'd like to direct a preventive measure question again to Ms. Pereira. As a behavioral health research consultant, what do you suggest that parents could do to prevent their children from falling into the grasp of this drug menace that's in our country?
I think, thank you for the question. One of the first things that a parent can do is first educate yourself on what drugs are. What does addiction mean? What are the different substances available? What are party drugs? What falls under this? How do children generally access it? So that then they could have, and also improve the dialogue that you have with your child on being able to talk about sensitive issues. Because a lot of children don't come out with the stresses they face, the difficulties, because sometimes the pressures also come from parents and other, or teachers or the school systems. So developing a communication, like an open dialogue with your child is, I think, important. And especially, and also one thing is parents being aware of their own mental health. Every parent, we don't have a guidebook. Every child is different. So having that insight to how you feel as well about a certain drug or about a certain issue, what is governing your biases and what's your awareness of it, I think is important when you have a conversation with a child who's going to ask a variety of questions when they feel comfortable. And also giving them a place to go when they need help.
Also, when it comes to the labels, the label of a drug addict, especially I ask this question because say a child is addicted to using drugs and he is caught using drugs or in possession of drugs within the premises of their school. School authorities will not be too, for revealing this fact or even revealing it, maybe revealing it to their parents, but to the relevant authorities to direct them to proper counseling. What can be done to address this issue?
I think especially in schools, educating teachers on how to handle the issue sensitively. Wherever the child gets caught, it's important that they feel safe and that they're not going to get penalized by the system. I think that's the biggest fear that people have, and that's why there's a lot of undetected issues that go on. So having, yes, counseling, which I think most of these entities are engaged in actively, having that as a system where it's also the confidence of teachers to be able to counsel. And that's something that I work on with teachers every day. You have a lot of teachers who come and say, I know the theory, but I don't know how to actually do it. So there is a confidence issue that needs to be addressed as well when it comes to counseling. So, yeah.
Thank you very much. With that, we're going for our final break on tonight's show. We'll be right back. This is Face the Nation. Welcome back. We're in discussion with a fantastic panel of guests here this evening. My final question to DIG Ajit Rohana, attorney at law from the Sri Lanka Police. DIG Rohana, the relationship between the Sri Lanka Police and the citizens of the Republic needs to be one where there is a lot of trust and faith, where people, when they have an issue, have the confidence to go to the police station, and where the police has the skills, the technology, and the sensitivity and the methodology to deal with these issues in a successful manner. Are you satisfied with the Sri Lanka Police's standards in terms of what I just asked?
No, actually, we need to increase our standards in order to deal with this drug issue. Especially, we need to use more and more technology, the modern concept, best practices. especially, I mean, apart from this particular existing dangerous drugs ordinance, so there is an amendment coming. We need to extend the detention period also. Now, if a person is involved in a drug issue, drug trafficking case, so according to the existing law, we have only 7 days to deal with the issue. So after that, the suspect should be remanded. But it is not sufficient because the drug dealers or the drug traffickers, they are involved in, the activities are involved in multiple jurisdictions. Sometimes the predicate offense committed in Afghanistan, the second offense committed in Pakistan, the third offense happened in Chennai. Finally, the drugs have been brought to Sri Lanka. So therefore, we need to incorporate the contents of the international conventions into the domestic legal system. And apart from that, if an individual thinks that it is combating drugs or the eliminating drug problems is the sole duty of the police, it's a myth. So it is a duty of the police and a duty of the parents, duty of the religious leaders, duty of every individual. And apart from that, it is a duty of media also. So media also has a very big role. So therefore, on one hand, we need to minimize or the reduction of the supply. On the other hand, reduction of the demand. Then everyone thinks of this particular concept. So definitely, I believe that we are an island nation. We can minimize or eliminate this drug problem if we work together. We have a proper coordination within a period of 5 or 10 years' time.
Fantastic. Thank you very much, DIG Ajit Rohana. Ms. Pabasara Veerasinghe, Assistant Director, Scientific Research from the National Dangerous Drugs Control Board. During the course of this discussion of almost 2 hours, we discussed multiple issues concerning drugs and drug abuse in Sri Lanka. One of the key concerns that you raised was the fact that the National Dangerous Drugs Control Board requires greater budgetary allocation for you to conduct the programs that you do. In addition, you also raised attention to the fact that there needs to be more scientific research to get to the root causes of why people get addicted, adding that it's not happening adequately at present. I'd like to ask you, Ms. Pabasara, now in other countries we see the manner in which there are commercials on TV, radio, social media about the ill effects of drug use, which are really gripping. You don't feel like consuming banned substances when you see those commercials because it's so scary, it's so effectively done. Why can't we use these methodologies? Why haven't we tried doing this?
Yeah, actually, Ms. Sonali, to a certain extent, I agree with you. But when we analyze the problem, then there are some people, those who get dependent on drugs, and the younger groups, they, even though we publish the dangerous and the damage the drug cause and how dangerous the drugs are, and we show them the evidence, there are some people that they tend to experience they tend to experience such dangerous issues also.
But that'll probably be a minority. What about the
No,
majority?
they are, because now we are analyzing the posts which are shared in social media, and there are posts that the posts are very scary to see, even for us. But when we analyze the comments they have mentioned there,
Right.
we see that how eager they are to experience on such dangerous
But do you
situations.
think that this necessarily means that you should not engage social media or mainstream media to talk about these issues,
Yes,
or at least
they
talk about the helplines?
Yes, they have to engage more on myths, because the people are get addicted because they are in myths which are not real.
So then, don't you think that it's important to shatter these myths through
Yes.
the effective usage of
Yes,
social media?
definitely we should. All of us focus more on the myths rather than showing them the danger of drugs, because they are the myths are the one they are hanged to, because they don't realize the reality of the myth they were in. That's why they tend to use the drugs. So we all should focus more on shattering these myths.
Absolutely. So, in a bid to shatter these myths surrounding drug use,
Yes.
do you think that as a representative of the National Dangerous Drugs Control Board, you could perhaps look at the option of organizing, for example, a multi-stakeholder meeting or several meetings,
Yes.
where you talk with advertising agencies, where you talk with people with creative concepts,
Yes.
and media organizations, print media, and multiple stakeholders, and come up with a very effective advertising campaign to make sure that this message is disseminated to the public. For example, we remember, I think it was in the 80s, where there was this very effective national campaign on Laduru, saying Laduru nittawata suwa kala haka. And there was this teledrama with Samitha Mudunkotua. So people were aware of that issue because of these effective methods of usage of media.
Yes.
Wouldn't you agree with that?
Yes. Yes.
All right. So I think that's something that the Dangerous Drugs Control Board could look at.
Yes, definitely, because with the new platform we are going to establish, we get all the sectors together, and then with the more involvement of scientific professionals and academia, civil society, volunteers, and even the general public, we are going to give effective solutions to the nation to solve this burning issue in the country.
All right. Great. Thank you very much, Ms. Pavasara Veerasinghe, for your final remarks. Mr. Jomo Uduman, Honorary Director at Melmadura. The stigma surrounding people who are affected with substance, who are affected as a result of substance abuse, and their families. If my child is an addict, a drug addict, how should I, from where will I find this, the knowledge and the skills to deal with this problem, Mr. Uduman? In Sri Lanka, is this help available for families dealing with children who are addicts?
Unfortunately, not around Sri Lanka, but at Melmadura, yes, we deal with families and the user in daycare. In the sense, they do come in, the families are taken separately, they are empowered, and they are also like taught to applaud little successes in the child, rather than, condemn the child, oh, you're smoking again, or again you're taking a drink, or whatever.
Perhaps we could use Melmadura as a sort of structure on which we could base a more regional or a national level mechanism.
Yes, because one thing is your comments on that advertising campaign is fantastic, but that's what we need really, The don't drink, don't smoke, don't do drugs slogans don't work anymore, and that has been proven. What you need to tell people is show them different options, a healthier lifestyle, and then also show them where help is. for the vulnerable people. It's very important. You know that in the UK, any report on suicide has to have a helpline at the bottom. Vulnerable people, instead of using it as an option, suicide as an option, you seek help. So that way we got to get our media also galvanized into action, where even any report on the subject of drugs offers some support system to people who are reading it.
The other thing, Mr. Uduman, is most of these programs that are available are either available in English or Sinhala. After the conflict ended in 2009, there was a massive increase in the incidence of drugs in the north and east of Sri Lanka. Are these materials, brochures, helplines, all of these things that are disseminated, are they translated into Tamil? Do we have enough psychiatrists who are conversant in Tamil? Have we forgotten about the north and east of the country?
What I can tell you is that after the war, the north has become the highest consumer of alcohol, number one. And there's one doctor in Kilinochchi, Dr. Jagar Ruben, who's doing a fantastic job there in the government hospital, treating people in-house, visiting them after they have been discharged, checking on their relapse patterns, bringing them back for help. So, where Melmathur is concerned, all our brochures come in Sinhalese, English and Tamil, because we have the capacity to deal with people in those languages. So it's very important. Even in Colombo, you do get people coming in for support and wanting to talk in Tamil.
In conclusion, what steps must policymakers take to ensure that the rehabilitation structure is enhanced?
I think number one is training the trainers. The trainers need to be trained, and for that you need expert guidance. And I don't think you can call them, you don't need to call them counselors, you can call them befrienders. People who befriend people in trouble, who understand them, who empathize with them, who are non-judgmental. That's what we really need, And that doesn't come with everyone. You can't train people to be empathetic. It has to come in you. So you have to choose the correct people. That is why at Melmathur we have volunteers. When you advertise for volunteers, you attract that type of person who wants to come and give his time to help others in need. Come and give his time to help others in need.
All right. Thank you very much, Mr. Uduman, for your concluding remarks. I move my attention now to Nilushka Pereira, Behavioral Health Research Consultant. Nilushka, why do you think people who suffer from substance abuse are cornered by society, their families are cornered by society? What is it in people that brings out that sadistic side where they ridicule others who are suffering? I mean, I'm asking you this because you're a behavioral health research consultant. Why is it that this issue of stigmatization is so huge, especially in Sri Lanka? Why are we the first to shun people, look down on people who are suffering from issues rather than lending them a helping hand? We have Buddhism, Catholicism, Islam, Hinduism, all these fantastic religions which teach us fantastic things, yet why are we like this?
Interesting question, Sonali. I think I'm going to introduce you to a concept called collectivism, right? So collectivism and group thinking is how we act as a group. So Sri Lanka is a collectivistic nation because we care about what other people think about us. Even if we buy a new car, what is my neighbor going to think about it? So it just happens that we are very much concerned about our external appearance. how we are seen to others. So with that comes this need to always project this perfectionist, that my family is perfect, I have it all together. This projection that actually has a lot of strain on people. So with that comes this ease that, oh, you messed up. Because then that group thinking or that collectivism breaks off because one person just acted out of the norm. So it's not just for drugs or alcohol. We stigmatize people who are disabled. We stigmatize people with mental health issues. We stigmatize people who are just a little different than who we are, who we think we are. So it comes with intense group behavior. And I genuinely believe that we as Sri Lankans, we take care of each other, right? So this collectivism can have the negative consequence, but the positive side of it is that we will take care of each other. If something happens to us on the road, we will definitely stop and help, right? Which you don't get in a lot of Western countries. So using that as a potential to grow and take care of each other and make sure that we look out. So using that collectivism as a strategy is something that we could inculcate and show people maybe we could do this. So that's an interesting way to take the stigma to a different.
Now you studied about this concept because you studied psychology. But don't you think that something like this needs to be taught at school level at a very young age?
I mean, just as we spoke, introducing emotional intelligence, introducing coping strategies to school-based curriculums will enhance and improve how children and adolescents and even after A-levels or university students see themselves and know which resources are for yourself. What about you is going to make you as a strength for you. So I think definitely including.
Thank you. So that will be one of your recommendations.
Yes, of course.
Fantastic. My final question to SSP Tilak Dhanapala, Director of the Police Narcotics Bureau. DRG Ajit Rohana mentioned about Praja Police Committee or community policing committees. Now, these come under the Police Narcotics Bureau. So you directly monitor all of these committees?
Sonali, actually that this community police committees normally supervised by, we have a division called that community police division. And also that actually that we have now that 14,068 community policing committees, all covering all island, covering each and every corners of the island.
Right. And what's the task of these community police committees in terms of prevention of drug trafficking, etc.?
Yeah. Actually, Sonali, in these committees, actually that we have only that 14,022 Grama Niladhari divisions in Sri Lanka. In each and every division, we have at least one committee, that Praja Police Committee or Community Police Committee. In each committee, we have members from minimum 25 up to 30. In that committee, Sonali, we have a subcommittee called the Drug Prevention Subcommittee. In that subcommittee, we have members from 5 to 7, including Grama Niladhari in each Grama Niladhari division. It means we have 14,068 that drug prevention committees in the island.
Are these all active?
Yeah, all active actually,
right,
to address the issue in root cause in grassroots level.
Right.
Actually, they have three main responsibilities. One is that collecting information in that area, in that region, in that village, particular village, and provide those intelligence information to the police and other law enforcement agencies. And the second one is that conducting small-scale prevention methods like that, small awareness program like that. The third one, very quickly say you to assist the rehabilitation process, because actually that OIC in the respective area, he has the power to send those drug addictors to rehabilitation through courts that after that produce him before doctor, then go to the court, ask from the magistrate to send them to the court. Then for that aspect as well, that this committee should assist.
So all this data is with the Police Narcotics Bureau?
Yeah, actually.
Is it also shared with the Dangerous Drugs Control Board?
Sure, yes.
Right now it isn't?
Yeah, right
but
now.
You're willing to share the...
Normally actually that with the Police Narcotic Bureau and the Dangerous Drug Control Board, we are working together daily. And that 1984 center, our operatives are there at their center.
Right.
That they are answering to those
calls. Is it a 24/7 hotline in 3 languages?
Yes.
Okay, fantastic. Well, with that we wrap up this edition of Face the Nation. Thank you very much for tuning in. Very quickly, I'd like to thank our fantastic panel of guests for their time and contribution. On to my immediate left, DIG Ajit Rohana, attorney at law from the Sri Lanka Police. Thank you for your time. Ms. Pabasara Veerasinghe, Assistant Director, Scientific Research, National Dangerous Drugs Control Board. Thank you, ma'am, for your perspectives as well. Mr. Jumo Uduman, Honorary Director, Melmadura Sumithrio Drug Demand Reduction Program. Thank you for your perspectives as well. Ms. Nilushka Pereira, Behavioral Health Research Consultant. Your first time on this show. Thank you for your thoughts as well. And finally, SSP Tilak Dhanapala, Director, Police Narcotics Bureau. Thank you for the service you render.
Thank you.
As well. Thank you also to Charlene Benedict and Deshan Gonavala for your questions. Unfortunately, we weren't able to bring in a psychiatrist to this panel discussion. However, this has been a continuing topic that we've tried to focus our attention on. Thank you so much for the questions that came in as well. We focused on several areas pertaining to the drug menace in Sri Lanka, including the need for better treatment facilities in terms of psychosocial care, the need for education reform, as well as the need for greater sensitization when it comes to the police and other law enforcement agencies. Thank you so much for your time and for being with us on this edition of Face the Nation. We'll see you again next Monday at 9:30 p.m. Good night.